This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. COVID-19 has been a topic under discussion since the first cases appeared and remain one of the most discussed themes in the present. Its unexpected appearance has puzzled many, as most people were unprepared to face it. With recent shifts in treating this disease and forming the proper protection against it, there is an expectation that humankind may one day live in the manner it used to. However, it is vital to assess better the damage done in different aspects of life to understand the world after COVID-19 better. COVID-19 has affected the world extensively and has appeared to be a significant issue, leading to many significant changes in people's lives. The impacts of COVID-19. In discussing the world's future, it becomes essential to examine the aspects of life that the disease has affected the most and the changes that happened or are to happen because of it. Particularly, COVID-19 as a disease has primarily affected many areas of the economy and, most importantly, human health in general. In addition, there are modeled scenarios forecasting the future life after COVID-19, specifically in the United States, which is also worth mentioning. Examining the aspects of alterations might be helpful for further understanding of the issue on the surface. The global pandemic had infiltrated a significant part of people's lives, but most importantly, their health. Some of those directly impacted by the coronavirus have yet to regain their abilities, while some were not as fortunate to survive the disease. The human losses were numerous and later led to mental health decrease in people regarding the fear of the pandemic. The survivors of COVID-19 are also suffering the consequences, and the recovery period happens to be longer than expected. According to Gemelli against COVID-19 Post-Acute Care Study Group, the recovery length depends on the extension and severity of the attacks in organs and cells. Although there is a lot of research done in the area, the clinical picture of the infection appears to be quite vague. Further information regarding the consequences of COVID-19 might be better obtained through an interdisciplinary approach, as the disease affects multiple organs apart from its primary focus, which is the lungs. Therefore, considering the long-term outcomes of the disease, its impact on people's health is massive and remains one of the concerning factors in the area. Considering the scale of the problem that SARS-CoV-2 has created, health is not the only aspect that the damage was done to. The economy was primarily affected too. The pandemic has tested the effectiveness of public health and economic systems worldwide, and only a few have proved their worth. Developing countries have appeared to be quite vulnerable to the pandemic without international support, and the financial burden put on countries is disrupting the economy. The guidelines set to prevent the disease from spreading have caused many facilities to halt their production, causing economic distress to happen. Small businesses that require close contact communication between staff members and customers suffered substantial financial losses and had to reevaluate the risks and options for future development. Despite some countries proving to be more successful economy-wise during the pandemic, the repercussions worldwide remain immeasurable. The appropriate examination of the outcomes that COVID-19 has led to help identify the model scenarios in which the society will exist in the future. According to Reiner et al., one possible scenario would be the continuous mask-using process even after the pandemic. The results of such a strategy are uncertain, yet it may lead to lower risks in the human factor and might be simple to adopt. Another strategy would be mandate easing, which implies removing the guidelines set for the time of the pandemic and may lead to harsher consequences as a result. However, implementing two strategies may lead to better results and lower the pandemic's death rates. Therefore, considering the state the world is in after COVID-19, the strategies implemented must align with the outcomes and aspects of life that are present now. Although the aftermath of the pandemic is quite evident, there are opposing views regarding the issue. Firstly, some may argue that this pandemic is not as big of a problem as it seems, and some diseases need more attention nowadays. For instance, HIV, human immunodeficiency virus, aimed at the human immune system present for many years prior, is claimed to be more dangerous than COVID-19. However, this argument is not quite right, and the reason for it lies in the fact that SARS-CoV-2 is easily transmitted from one person to another through airborne droplets. In contrast, HIV is contagious via needles and unprotected intercourse. Therefore, although HIV is dangerous, it is not as transmittable as COVID-19, making the latter more dangerous and worthy of research. Conclusion. In conclusion, the world after coronavirus will perhaps be different from the one people are used to. The impacts of COVID-19 are significant and deserve future exploration. Public health systems might turn to an interdisciplinary approach to see the effects of the disease long-term. This infection is hazardous, and it affected the world's well-being in general, including countries' economies, creating a financial burden for many. Although arguments claim that COVID-19 has disproportionate attention compared to other illnesses, it is vital to mind its contagious properties and put health first. If you want to find more works like this essay on World After COVID-19, Changes in People's Lives, head over to ivypanda.com. It has a collection of samples with thousands of submissions covering virtually all academic subjects.